Hello, everyone. My name is Dr. Kristen Wright, and I'm a registered psychologist with Con Communications. Today, I'll be presenting on the topic of understanding specific learning disorders and how they differ from intellectual developmental disorders. Before I begin, I'd like to first acknowledge that we are on Treaty 6 territory, a traditional meeting grounds, gathering place, and traveling route for the Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux. We acknowledge all the many First Nations, Métis, and Inuit whose footsteps have marked these lands for centuries. So just to begin, we'll take a look here at advancing here. Some of the objectives of the talk for today. First, we'll look at defining what specific learning disorders are. And exploring different types of specific learning disorders. I'd like for everybody to come away from this presentation also with an understanding of the characteristics of an intellectual developmental disorder and how that might differ from a specific learning disorder. We'd also like to discuss some of the implications of either of these different disorders for teaching and support of students. Because at times there are different teaching strategies that would be used for these two different groups of students. So to kind of begin here, taking a look at what are specific learning disorders, there are criteria that are set out in our DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. And that's the book that psychologists would use to make a diagnosis of something like a specific learning disorder or an SLD. And the criteria for these are that a student would have difficulty in acquiring skills in reading, writing, or math that are substantially below the expected level for a child's age. And that these difficulties need to persist for at least 6 months, and they need to persist despite adequate instruction and interventions that target these areas. So that's where initially referring to, for example, a learning consultant for that intervention strategy really matters, because we're looking at difficulties that persist despite those interventions. We're also looking at difficulties that are measured with the use of a standardized assessment. So that's an assessment that has been given across a variety of students at each age level across Canada, so that we can make statements that are really more comparative of the individual student to students across Canada. Not just students within your school or students within Alberta, for example, because we do find that for sometimes Alberta education curriculum may or may not be aligned with sort of these kinds of standardized tests. And we also want these difficulties to not be better accounted for by an intellectual developmental disorder, by vision problems, by lack of proficiency using the English language, or any adversity, like if we're talking about significant traumas. Where intellectual developmental disorder is concerned, yeah, that is a specific different diagnosis, right? And so you can't have a specific learning disorder that's better accounted for by an intellectual delay. And we'll get into what those are later on in this talk, but that is why they're relevant here as well. Okay, so it is a mouthful, like the criteria for a specific learning disorder. And in fact, those are some of the basic criteria, but they do become more detailed as well. So what is a specific learning disorder? Research today is now developed and progressed to the point where we're understanding SLDs as being neurodevelopmental, meaning that they're often kids are born with these things. These things can run in families. There are genetic links to things like dyslexia or learning disorders. And what we know about them is they're not due to lack of motivation or too little instruction. So they're not due to, say, children missing 50 school days per year. There we might expect there to be gaps in learning, right? because we're missing a significant amount of instruction. Um, for English as an additional language students, with these students who have less than 5 years of instruction in English, we would also expect them to be below grade level, really due to reduced proficiency in English, and that not being necessarily indicative of an SLD. It is interesting because could an EAL student have an SLD? Absolutely. Is it going to be easy to identify if a child has had less than 5 years of instruction? It will be very hard to identify. And that's why we have those guidelines set out. Again, they're guidelines. They're not a hard and fast rule. But what we do find is even once a child obtains conversational English in a way where you assume that they have probably enough, that they should be able to bring themselves up closer to grade level. What we find is when we still test that child's vocabulary in ways that would impact reading and reading comprehension, there will still be delays, or not delays, but differences, because that child isn't truly delayed, they're just really learning English. So our guideline is that we would like for children to have had 5 years of English language instruction in school before referral for an SLD. If you have concerns about an EAL student where the concern is broader than an SLD, so it's more than just reading and writing, and it's like, say, all aspects of their life, including their adaptive skills, including parents having significant concerns at home with their ability to do age appropriate activities. For those students, we may still assess those students because we may be looking more for a broader cognitive delay. The other thing to keep in mind is if an EAL student has delays in their first language, so if parents are concerned with their skills in their L1, that would also be one of those flags that maybe we should assess them at less than 5 years of instruction. So it's not a hard and fast rule, and I would say definitely talk to your con team and talk to Trina as well if you have students like this where you're wondering and you're really concerned. The challenge is that for an SLD specifically, it can be really hard to tease that out if the student hasn't had those 5 years. There are, of course, other things that could affect learning for those students where the 5 years wouldn't matter as much. What we also find is that low academic performance could also be due to an intellectual developmental disorder. So that is a child with low IQ. And so this could really only be teased out by having the student complete an educational psychology assessment. Um, and really, prior to that educational psychology assessment, they could be seen by a learning consultant and they could have had an academic assessment completed. That academic assessment is not going to differentiate the root cause of why the learning is lower, but it will tell you that learning is, for example, in reading at the second percentile. But that won't tell you whether it's at the second percentile due to an SLD or at the second percentile due to an intellectual developmental disorder. And that's why that educational psychology assessment is really important to figure out because strategies are going to be different for those two groups of kids. So what we know is that specific learning disorders aren't rare. So between 5 and 15% of school-age children are affected. And there is a heritability here. So they are between 4 and 10 times more likely to have an SLD if there is a first-degree relative who also has an SLD. So when parents come to you and they're concerned about their child's learning and they say, you know, I struggled in school or I have dyslexia, that's another one of those flags where we might say, okay, I'm going to note that down because that is actually going to be more likely that potentially their child might follow that same path. So we do want to listen to our parents when they are concerned. Absolutely. Um, In terms of characteristics of SLDs, it's interesting because when I first did my graduate training, we learned more about the traditional view of what an SLD was, which was more defined by unexpected underachievement. So that would be a student who has, say, average to above average IQ, and yet their learning was still substantially below that, despite, having intact IQ and interventions to support it. They are just really struggling. And that might be what we would traditionally think of as, if there are reading difficulty, like a dyslexia. Um, in our current DSM, SLD now includes this group of children, sort of that traditional view, but it also includes a group of children who might have what we would consider to be what's called borderline intellectual functioning. So that would be an IQ that's below average, but not low enough that they would have an intellectual developmental disorder or a cognitive delay. So it's kind of in that borderline range between what would be average and what would be considered a mild delay. But children in that range, even though, so borderline intellectual functioning isn't an actual diagnosis in the DSM, um, it is something informative in practice because children with this IQ range will be expected to actually have more difficulty with academics. Um, and that's not surprising. So it's not that it's unexpected underachievement, but it is still underachievement. And it's underachievement in comparison to what would be expected based on their age, even though it may not be unexpected based on their IQ. So there are kind of two groups of kids that are now being lumped in under SLDs. And this can actually be helpful for teachers to know when they're reading the results of a psych ed assessment. Because a traditional SLD where the child's, IQ is average might look different than a child who has lower IQ, and therefore their learning in, say, not just reading is affected, but it's reading, writing, and math. So it's not actually specific in the way that we might think of an SLD. But they're also in this category. And I think that is the case because they're also very much still in need of supports. And I think these students probably do benefit from all of the same kinds of extra enrichment supports that a child with a traditional SLD might have. Okay, so we will take a look at this normal curve. It's got standard scores that would exist in academic and IQ tests. So both types of tests would generate a score like this, where we can plot it on the normal curve and we can say, is it within the average range? Is it low average? Is it extremely low? So where kids with an SLD would be concerned is most of these kids are having at least borderline intellectual functioning or higher, right? So we are looking at kids who would have an IQ at least, say, above 75. So they don't have an intellectual developmental delay. And it would be helpful kind of to think about this normal curve as if we were to test, say, 100 students the same age as the student that you have in question, where would your student be placed in a lineup of those 100 students according to various different skills? So where the average is somewhere between 25th in line and 75th in line, that's sort of where we're looking at. So often in SLDs, we have kids who have IQs within the average range, but then they would have their learning within that lower range. So maybe even within the range of what we would see on this graph as being part of the intellectual developmental disability, but they're really not intellectually delayed, right? Their learning is just on that lower end of the normal curve. That's going to be important as we're talking about these things. So there are different types of specific learning disorders. So three types that we diagnose would be a specific learning disorder with the DSM will say with impairment in reading, which is pretty much the same as what we used to refer to as dyslexia. So if we say an SLD in reading and the child meets sort of this profile of dyslexia with these difficulties in phonological processing and difficulties with spelling, I mean, the two terms would be kind of synonymous. So if parents find it more easy to understand it as talking about dyslexia, know that we're kind of talking about the same thing. Um, there are types, the second type there of a specific learning disorder is with impairment in written expression. And this might be synonymous with terms that you would be familiar with around dysgraphia. So written expression and dysgraphia are kind of interchangeable. Where specific learning disorders with impairment in mathematics would be kind of synonymous with what you might call a dyscalculia. Now, of course, kids can have SLDs in one area, in two, or in three areas. So it's not necessarily the case that it has to be only one for this diagnosis to be given. In fact, areas of reading, if we were to dive deeper into each of these SLDs, kids with SLDs in reading could have difficulty with any of the following things. So it doesn't have to be all of them. So they could have difficulty with just the word reading accuracy or the phonological kind of piece of reading. They could understand that phonological piece, but really struggle with their reading rate or their fluency, where it takes them much, much longer to read a passage. So we're giving extra time on tests because the student can read, but it just takes them such a long time. The other piece of reading that can be affected is reading comprehension, right? So we look at the difference between word reading and reading comprehension. And this is something that psychologists often look at to know whether both are impacted or just one. Many children with kind of the primary dyslexia type profile will have difficulty with the phonemic awareness, decoding, spelling, but don't always have difficulty with things like comprehension because their IQ would almost buffer that a little bit. They'd be able to use their background knowledge to come up with reasonable guesses when it came to comprehension, but they would be really, really struggling at the word level. So that might be the group of kids that kind of had more of a primary dyslexia. Children who have a co-occurring intellectual developmental disorder are more likely to have difficulty with all aspects of reading. That's the reading, the decoding, how quickly they read, as well as what they understand of what they're reading. So that's a different kind of profile there. And in that scenario, they wouldn't be diagnosed with an SLD. They would be diagnosed with an intellectual developmental disorder. But the testing results, when you look at their academics, are going to look like all of these areas of reading are affected, and they're all really quite low. Many children who have a co-occurring autism spectrum disorder have interesting things when it comes to reading because we have some subset of kids with autism that have hyperlexic reading abilities. So they're really able to decode quite quickly and quite fluently. And they might not even be decoding according to phonemic rules. They may be decoding more according to memorized chunks of like these letters always go together and they always spell this word kind of thing. Children with autism who are decoding at kind of hyperlexic readers with great decoding, they may not always be able to comprehend. So what we do sometimes notice in some kids with autism is that they can read really well and they might pass all their reading benchmarks. But then when it comes to comprehension of what they're reading, that's where things get tricky because comprehension also involves things like social inferencing. for example, and a child with autism might struggle with the inferencing aspect of things. And so reading comprehension is not going to be always a strong suit. That is not to say it's a general rule that this pattern is true for all kids with autism. Absolutely not. The other piece to note is that a child with autism can still have a specific learning disorder. So those two things can co-occur together. When we talk about specific learning disorders with impairment in writing or dysgraphias, these can affect things like spelling accuracy, and often children with dyslexia will also have trouble with spelling. So they would receive a specific learning disorder with impairment in reading and writing, most likely, because it would affect spelling and that phonological process involved in spelling. There are children who can spell, but where it comes to writing, it's in that application of grammar and punctuation that ends up making their writing more difficult to read, or making the writing less aligned with their grade level. Some children also struggle with organization of their writing and writing clearly, so understanding their audience and providing their audience with a lot of background information that's necessary to kind of set the stage for the story or provide a narrative that actually makes sense with a beginning, middle, and end. All of those aspects of reading or writing can be affected in a child with an SLD, an impairment in writing. It is interesting because those all seem quite different. SLDs in reading and writing often come as a pair because of the influence of phonemic awareness on writing as well. Now, children with difficulties around the motor component of writing. So that's that graphomotor, holding the pencil too tight or too loose, not using the tripod grasp, kids who are fatiguing really easily with just a little bit of writing. That's that motor piece of writing and letter formation. It's often kids who struggle with spacing in their letters and words and have no stamina for writing, really. Those kids, I would say, you might want to refer to an OT, actually, because that might be related more to broader difficulties in motor skills or motor planning and less to do with a learning disorder. So kids can have what's called developmental coordination disorder or developmental dyspraxia, where that's more of a motor disorder that would affect writing, of course. So it's more of the graphomotor component of writing. But definitely we see a lot of frustration and maybe behaviors around writing too. So where there's only a concern about writing and maybe not reading, you might consider referring to an OT so that they could assess a little bit more the motor piece, because that's definitely linked for a lot of kids. Most definitely. So yes, SLDs in reading often occur with an SLD in writing. They're referred to as dysgraphias. Children who have motor components of writing, just to review, we would refer on for OT. Specific learning disorders with impairment in mathematics can affect a number of different areas of math reasoning as well. So it can affect a child's number sense. It could affect a child's memorization of arithmetic facts, how accurately and how fluently they're able to calculate things, as well as their math reasoning. If a child has difficulties in math but does not have difficulties in reading and writing, sometimes it can be about attention, like to the multiple steps and making an error at one of the steps. Sometimes it can be about checking your work. Often we do find that difficulties in the area of working memory for a child can affect math quite specifically because we're often working with multi-step problems as math curriculums advance over the years. And that ends up being the thing that actually impacts their ability to do the math, not their ability to think conceptually about things, but actually to do fluent and accurate calculations because they might be missing a step. Um, Definitely children who have co-occurring ADHD can have trouble with this area too, because working memory can be an area of weakness for some of these students as well. So just some things to keep in mind about why some children might struggle in math. When we look at an SLD, if a psychologist provides a diagnosis of an SLD, we do try our best to specify whether that is considered to be a mild disorder, a moderate disorder, or a severe disorder. Um, and the way that the DSM describes these three different um, levels would be a mild SLD would be a child who's able to compensate or can function fairly well with accommodations, a child who can make consistent progress, although that progress will be slower still. And really a child who, with that extra help and intervention support, seems to be doing okay, even though they're probably still below their grade level. A child with a moderate SLD would be unlikely to develop the skill at all without this intensive intervention and support. So this would be a child whose parents are working really hard at home. They're doing their home reading. They've maybe got the child in extra tutoring. The child is receiving pull-out supports at school or leveled literacy. And like with all of these extra supports and accommodations, they wouldn't have developed their skills and made consistent progress without all of that. So it's not that they're not going to learn reading and writing, because they will probably, but they will probably always require accommodations, for example, in the workplace. If the job requires a lot of reading or writing and that happens to be their area of disability, they'll probably require some accommodations for or modified work. Somebody with a severe SLD, it's usually affecting several academic domains, and the individual is unlikely to be able to learn these skills without intensive support, without specialized teaching, and even with these accommodations at home, at school, at work, the individual may still not be able to complete all activities. So there may be still some things that this person would have difficulty doing without, say, the ability to use voice to text or text to speech. These types of accommodations are really integral to their ability to function, right? So even to make a grocery list would be hard without those accommodations. So that's kind of the severity descriptions. There are times where the psychologist will diagnose an SLD, but not specify the severity. And that's sometimes because there are some things that are unclear about the profile. For instance, if a child has had prolonged absences, or if a child hasn't really had optimal intervention yet. So we can't say whether or not they would respond well to interventions if the interventions were kind of waiting for the diagnosis to be applied. I know it seems like circular reasoning, but sometimes there are situations where schools are waiting for an assessment in order to know what intervention to provide. And if this is the diagnosis they land on in the end, then it would be unclear sort of what kind of progress the student would be expected to make. I hope that makes sense. So now we're going to jump to talking about what are intellectual developmental disorders and how they differ from an SLD. So an intellectual developmental disorder is a condition for a child where they have deficits in their intellectual functioning or their IQ, as well as deficits in their adaptive behavior. So that's their daily living skills. So these would be children who are born and who throughout their developmental trajectory have always kind of been behind in a variety of areas, not just once reading and writing take the stage in school. So they would be kids who have had difficulties with like toileting and dressing and independence in routines, even in kindergarten, where we wouldn't necessarily expect them to have difficulties with some of those daily routines that are not literacy based. Certainly literacy-based activities will be harder for a person with an IDD, but what it is a more global delay, right? So they're also referred to as an intellectual disability or a cognitive impairment. So somebody with an SLD might have similar academic scores as someone with an intellectual developmental disorder, but the reason for those low scores are totally different. And a child with an IDD will make slower progress towards academic goals and require lots more repetition. And there very likely won't be an aha moment where that learning just takes off because there's conceptual and analytical reasons in their brain why things are taking longer. So back to the normal curve. Here, what we're talking about is this blue bar of intellectual developmental delay or intellectual developmental disorders. And these are typically kids who have an IQ below 70. And their adaptive skills or their daily living skills would also be below 70. So what they would receive a diagnosis of an IDD instead of an SLD because it would explain more of these global deficits that they have rather than deficits that are just specific to learning in a school environment. So that's kind of the difference. In the next slide, we'll take a look at comparing them next. But some of the characteristics of kids with IDDs would be significantly lower IQ and adaptive skills. And usually these are things that parents are paying attention to and noticing well before a child even enters school. Whereas an SLD might only come up after a child is, in kindergarten, grade 1, and that phonemic awareness and literacy is really difficult, right? So this is a child who has broader developmental and cognitive challenges. So these are the key differences between an SLD and an intellectual developmental disorder. IQ with an SLD needs to be above 70 or tends to be closer to average, even though there is room for kids that are in that borderline range. Whereas an intellectual developmental disorder, the IQ is well below 70. The scope of the difficulties that a child has with an SLD is specific to academic skills. So they would not have global deficits in, say, motor planning, in community safety, in language understanding. They wouldn't necessarily be globally delayed. Whereas someone with an IDD would be having broader cognitive delays, there would be academic delays, and then there would be also adaptive skill delays. So that's somebody who's more globally delayed. With an SLD, the onset tends to be during those learning years. So you would maybe notice it in kindergarten and grade 1 when we're doing those kinds of literacy-based activities. Whereas for an intellectual developmental disorder, it would be noticed much earlier. The nature of both of these conditions is neurodevelopmental. And what we now know is the nature of both are genetic. And so they're not all that different from how they originate, though I'm sure different genes are involved in each of these different disorders. In a specific learning disorder, it's a learning-based trouble, whereas an intellectual developmental disorder could be considered as well partly an injury to the brain. So those can come about due to brain injuries, but they are also differences in the brain. So the implications for teachers when it comes to learning and teaching these two groups of students are that, recognizing this difference is going to be important for teachers because a child with an SLD would have preserved other aspects of their learning and they're functioning within the school environment, whereas a child with IDD is going to require strategies across all areas of their learning. All areas of their existence in school and maybe beyond, of course. Whereas a child with an SLD may not require accommodations that are different at home outside of maybe extra tutoring or more reading support or things like that. A child with an IDD will definitely have things that they're also working on in the home environment. So there are these adaptive skill differences between the two groups. So that's why recognition is important. And kids will require different teaching strategies, and the trajectories of these two groups may be different as well in terms of learning and programming. So one area of support that you all have is to collaborate with your team of specialists, as well as with parents to really sort out where a child might fit. And I would certainly say if either of these things are queries from the learning and parent kind of side of things, a referral for an educational psychology assessment would be a good idea. And really, that is because we can help differentiate those things and provide really more tailored recommendations for students. Implementing the appropriate accommodations and interventions is going to be important. So that's why this whole recognition piece is going to be key. Strategies and best practices for children with a specific learning disorder. We're really wanting these kids to have a multi-sensory approach to learning. Structured literacy programs like leveled literacy intervention or reading recovery, those things would definitely be supported. Not to say that for a child with an intellectual developmental delay, those same programs couldn't be used. I would say yes, absolutely, do use them. Knowing that frequent and distributed reading practice with feedback is going to be really important for an SLD, because we may find that with that extra feedback, it's allowing that student to make fewer mistakes when it comes to decoding. And so they're writing into their brain the proper way of saying and reading something rather than struggling and almost remembering the incorrect way of saying something. I would definitely say consultation with a learning consultant would be a helpful thing to do for a child with an SLD. For a child with an IDD, I would say simplifying the instructions. So paring down these instructions and communication, the language that you're using for the child is going to be helpful. Really repeating the concepts more, because they're going to learn through repetition a lot better. Modeling, so using anything hands-on and anything that is related to concepts or real-life examples is great. These students are going to need a reduction in the volume of material because they're going to require much more repetition to retain the concepts. They're not going to be able to learn the same volume of material or the volume of concepts. You'll also probably be looking at adaptations to the curriculum where you're reducing the complexity or you're reducing the grade level of programming and the level of abstract thinking that's going to be required for those goals to be met, because these students are really going to struggle with that abstraction part. You might also be focusing on functional skills, like what are the functional daily living math kind of skills you're going to need? What's functional literacy and numeracy going to look like for that person? Because we want for them to be able to be as independent in adulthood as possible. You're going to be using a lot more visual aids and repetition through familiar routines for a student who has IDD, because that's going to help them remember more of what the expectation is. So we'll talk a bit about these three different learning tools. So modification of the curriculum, adaptation, and accommodation, and how it would apply for these various groups that we're talking about. So children who require a modified program will require the learning outcomes to be significantly different from what Alberta education curriculum states. So it's not just, say, taking a student and exposing them to a curriculum of a few grade levels behind, but holding them accountable to that same curricular outcome. These are students that really need a high level of tailoring and modifying. Students who might be still working on one-to-one correspondence with numbers or phonemic awareness when the group is also working on like higher level reading. So when a child is on a modified program, typically they are not receiving a report card with grade level of programming indicated or a grade. Their IPP would have all of their learning outcomes and goals there. And so they would be not on a program trajectory, say in high school, where they would be receiving necessarily a high school diploma. They might be on a trajectory of maybe being in a K&E program or having a certificate of completion at the end. So that's kind of a student beyond modification of their programming. Most students who have intellectual developmental disorder, at least at sort of a moderate range of IDD, will require modification of their program. Students with a mild cognitive delay may not require modification, but they will certainly require an adaptation. So an adaptation is a change in the grade level of programming. So also a change in the evaluation grade level as well, of course. So it might be a student who's in grade 4 and is being evaluated and programmed at a grade 2 level, but they're being held to the curricular outcomes of the grade 2 level. And so that student would be able to receive a grade on their report card because they're being evaluated according to a curriculum outcome. And on the report card, it would just state the grade level of program, or GLP, is, say, grade 2 when they're in grade 5. So that's the adaptation. For accommodations, I would say it's interesting because accommodations will cut across both of these learning, different learning styles or programming. So for accommodations, sometimes there are students, say, with a specific learning disorder who are able to maintain the same grade level of programming, but they are needing support such as a reader or a scribe, extra time, say having assignments where spelling doesn't count, or be given a spell checker through use of a word processor. So these would be accommodations where the grade level of programming and evaluation hasn't changed, but these supports are provided in order for that student to achieve the best they can. These same accommodations, like a reader, scribe, extra time, could be provided to a student who is on an adapted program, and probably are and should be provided. So we're not just changing the grade level of programming for an adapted student, we're also adding accommodations that are going to help them. Okay, so let's go into an example. So we've got modified program is a grade 4 student, say with a moderate intellectual developmental disorder, receiving one-on-one support to work on self-care, phonemic awareness, counting with one-to-one correspondence, and there the grade level programming is not recorded. So a student with an adaptation or an adapted curriculum would be a grade 4 student with a mild intellectual developmental disorder, programmed at a grade 2 level of programming. So in English language arts and math, for example, they're doing the grade 2 program. They might be given a reader and scribe for tests and additional time, and they would receive small group support, say for reading and math, but their report card would be based on a grade 2 programming outcome. You can have students who are evaluated, say, according to a grade 2 level in language arts and math, and then at grade level or grade 4 level in science, as long as when they're providing their written work, you're still kind of evaluating them at the grade 2 level because we're not going to expect suddenly they're going to be able to do grade 4 level writing. So accommodations would be a grade 4 student, for example, with an SLD in reading or dyslexia, where they are able to read at a grade 4 level, for example, or can access material at the grade 4 level with programming supports like a reader and a scribe. Because this would be a child who, with a reader, can understand grade 4 level material. They would get additional time on tests or reduced number of questions in class. And their grade level of programming on their report card would still be grade 4. So that's sort of how these different kind of profiles of a child with a mild or a moderate intellectual developmental disorder might look, and a child with, say, a specific learning disorder in reading might look. So there's a lot of different combinations that can exist. So sort of in conclusion and kind of to take away from all of this is it's really important to recognize the difference between an SLD and an intellectual developmental disorder. And that identification is kind of at the starting point of how you're then differentiating your learning for that student. So we can differentiate things between SLD and ID for better support. And most definitely our con team would be great to answer any of your questions about, hey, how do I differentiate this? Say I have one student with an SLD and one student with an IDD in my class. What are the different supports that that same student in the same grade would need, right? Definitely reach out to the team with questions. The other piece is if you have students who are unidentified in your class where you suspect that there might be an SLD or an IDD that could explain some of these challenges. And there is a process, of course, to begin conversations. Talk with the con team, certainly talk with parents to see if they have similar concerns. Then you'd also talk with Trina to see if a referral for a psychology educational assessment would be eligible. And then that process will kind of start things going. So most definitely, even for students who are yet to be identified, there are some nice take homes from this where you may be able to apply some of that learning to students that you're not quite sure about. However, that recognition of the difference is important. And I would say, if you're not sure about a student, it may make sense to have these conversations and put forward a referral for them. Thank you all for your attention. And if you'd like to receive copies of the slides and the handouts for this talk, what we are asking everybody to do is email workshop@conservices.com and fill out a brief survey about the talk to give feedback here. And they will email you a copy of the slides or handouts for this presentation.